Hello, my name's Nick Wilkinson and I work in Sheffield IAPT, and I want to talk to you a little bit about some new support that we're offering in the service for those of you who might be experiencing difficulties with anxiety, worry, problems with sleep or stress related to the Covid-19 pandemic. So I just wanted to acknowledge that some of the things that have gone on in society over the last few weeks are very scary, and there have been lots of changes. The virus itself is very frightening in terms of the threat to health and the consequences it can have, and the danger to health that it can bring. And the measures that have been put in place by the government have meant that there have been massive changes to our usual routines and our usual way of life. In response to this, we can feel all sorts of different feelings and a range of different emotions. Some of us might be coping okay with things and perhaps on a day-to-day basis feel okay most of the time. But maybe some of us feel ups and downs in our mood. Sometimes we might be feeling anxious or on edge or tense or worried, preoccupied with all the news and all the concerns and all the stories that are going on in the media. These can make us feel tense and on edge and unable to relax, and maybe some of us feel panicky at times and highly stressed. Maybe the feelings intensify. For some of us, maybe we're also feeling sad at times or low or flat when we especially hear some of the very sad stories of people dying and some of the things that have happened in society. Perhaps also, given all the measures in place in terms of lockdown, some of us are feeling frustrated and irritable and maybe a bit snappy about the things that we're not able to do in our lives, and maybe feeling a bit cooped up, maybe getting those feelings of cabin fever. Maybe we notice changes in our energy and in our motivation and in our concentration. Perhaps too, we may have noticed changes to our sleep, maybe having problems with maintaining sleep or early waking, or problems with appetite, so maybe eating less or eating more. It can go either way. Taken together, all of these different sorts of reactions that we might have, and there might be more, we could describe them as stress. And these different reactions are all normal ways of responding to a time that is very, very scary and very, very challenging. So if you're feeling these things and you're struggling with them, this isn't a sign that there's anything wrong with you. This isn't a sign that you've developed a mental health problem. It's a sign and an indication that you're a human being trying to survive a very, very distressing, strange, challenging, frightening context. At Sheffield IAPT, we've developed some services, or a service that can help support you if you're struggling with these sorts of feelings and symptoms. We can offer you what we call psychological first aid, which means you can ring up the service and book an appointment with a colleague in IAPT, and we will try and understand how you're feeling and what's going on for you, and give you and provide you with ways that build on your own coping strategies or new things that you can learn to increase your sense of control and coping in this very difficult time. We've also got a new course that we've developed, which will be offered live online, which is a 4-session course called Coping with COVID. And in this course, you can, through attendance on week-to-week online webinars, learn new strategies and tips and techniques to look after your well-being during these difficult times. And also, IAPT is still open to people who are experiencing problems with anxiety and low mood. So all of our other usual business as usual kind of offers are still in place. We have a number of different groups that can help you with your anxiety or feelings of low mood. And we have courses as well in the Health and Wellbeing Service to help with pain, fatigue, health worries, and a number of others. If you're interested in getting some support or you'd really like to talk to somebody, please contact Sheffield IAPT on 0114 226 4380. Please do access support if you need it.